inserting pellets today. We chose to do the 200 milligram testosterone, and we'll have some pellets that will have 20 milligrams of anastrozole as well. We're using a 4.5 millimeter trocar kit, and we'll insert it in the left upper buttock area. This patient has had this procedure before and has done great, and we'll show you the rest. So here we have the kit, and here we have some of the pellets. These are some pellets with testosterone and anastrozole combined. So this is essentially the kit for the pellet insertion. We have pellets here. I'm going to drop them sterilely into the tray. That's 200. Another 200. We have some pellets that we have anastrozole. Okay, 220, 200 of testosterone, 20 of anastrozole, which is quite nice. Usually controls the estrogen very well in a slow manner, just like the testosterone absorption. So in this case, we are going to do a total of 1,000 milligrams of testosterone and 40 of anastrozole. So basically the patient is already in position. We're going to prep the area in a minute where we're going to insert the pellets sterilely. Okay, so we're going to start now. Let's prep the area. We're going to go here in the left upper quadrant of the butt. Just a little iodine. Sometimes we mark it with a pen to know the area and the distribution of the pellets, but I've done this before. I've done it on him several times, and I know the anatomy and I know the area. That's worked well in the past, so we'll keep it the same. Get a little more here. Pat that down a little bit. So we have lidocaine with epi. I like to use epi to control any bleeding. Remember, we don't want any kind of hematomas after the procedure. So we're going to go right here in the left upper quadrant. We're going to do create a little wheel, little pinch here, a little wheel there created, and now we're going to go deeper. Like in a 45-degree angle. And we're going to do a little flare pattern so we can spread the pellets on the subcutaneous. And that was like 10 cc, so that's a lot of, you should not be feeling anything. Plenty of medicine. Mm-hmm. An 11 blade here. We'll just do a small incision. By the way, this is a 4.5 millimeter trocar. The 200 milligram pellets can only be placed with using a 4.5 millimeter trocar. So basically what we're going to do here, we insert the trocar in here. And we made an incision already. We're going to go, like a 35, 40 degree angle. And right into the subcutaneous tissue, okay? Okay, we'll pull that out. Start putting our pellets in. You could put 2 at a time. I like to put this a little closer to me. It really helps can even put that over here for now. We're gonna have the plunger, we'll push them in. There you go, it went in very nice. So that's 400. Now we can back off again. Use a different location. Let's try over here this time. Good. And we're so good in there, we're gonna put the third one in this side right here. So that's 1,000 milligrams of testosterone. Okay, and then when you pull out, make sure you have the plunger in so pellets don't come back out with you. And now we want to hold a little pressure. We want to avoid any kind of hematoma. And just hold the pressure there. You don't even see a scar. You don't even see the incision, but we'll put a steri strip anyway. It's always good when the patient says, "Oh, is that it? You're done?"